The hefty age-long cliché, health is wealth, has stayed alive for ages with no recourse, owing to its limitless worth to human existence. The health sector's enormous significance makes it most needful and actively prioritized among other critical sectors of human development. Remarkably, the stretch of cutting-edge accomplishments, Dr. Ikram Hassan, from his assumption of office as CMD, in the last 2 years, has awakened the almost dead hospital as the state government prioritizes the health sector with the construction of 2 theaters as well as casualty theater, building and furnishing of a befitting ophthalmology complex, overhaul of the laboratory sample collection center, general outpatient department and pharmacy complex of Dash, renovation and expansion of the obstetrics and gynecology complex, neonatal unit and pediatrics complex, furnishing and putting into use the multi-clinic and the administrative complex of Dash. Its radiology complex now boasts of modern facilities and professional provision of additional befitting staff quarters with all conveniences, upgrading of Dash Central Sterile Supply Department and construction of walkways to the surgical and medical complexes, equipping of medical and surgical complexes, renovation of old casualty wing, amongst others. The Nasarawa State Governor, Engineer Abdullahi Sule's unrelenting resolve to rebuild the health sector has given more vigor to Dr. Ikram Hassan to detect the challenges, correct them, and to manage Dash professionally with an unbelieving commitment. Currently, Dr. Ikram Hassan had, on the request of Governor Abdullahi Sule, employed medical and non-medical professionals of all cadre into different departments in his quest to re-establish the hospital. Dr. Ikram Hassan has taken the bull by the horn by necessitating the accreditation of the obstetrics and gynecology department, family medicine department, internal medicine department, surgery and pediatrics department by the West African colleges of physicians and surgeons to commence postgraduate training in the state. This is with a view to improving the healthcare service delivery system in line with Governor Abdullahi Sule's vision of having a competitive health sector in the last 2 years of his assumption of office as Chief Medical Director. Human resource development has unfailingly been accorded prioritized attention for an enhanced service delivery, physician-patient relationship, welfare and safety of staff ever since Dr. Ikram Hassan assumed office in the last 2 years as Chief Medical Director of the Dalhatu Arab Specialist Hospital, Lafia. Engineer Abdullahi Sule, in his avowed determination, has put up a world-class infectious disease control and research center that will complement the efforts of Dash in diagnosis and prevention of diseases, which will place Dash on an enviable pedestal. Dr. Ikram Hassan, Chief Medical Director of Dalhatu Arab Specialist Hospital, has in a short time of 2 years walked the talk towards a healthy health sector to compete jealously with its peers in line with global best practices. This is to exceed the expectations of the Nasarawa State governments and its peoples.